Hi, my name is Nicole, and I'll be talking about bilateral tubal ligation and vasectomy as birth control options. So, a vasectomy is birth control that affects a male by cutting and sealing the tubes that carry sperm. It's usually done outpatient under local anesthesia, and it lasts anywhere from 10 to 30 minutes, and there's a very low risk. The procedure involves numbing the area by injecting the local anesthesia, then making a small cut in the upper part of the scrotum once the area is numb. They then locate the vas deferens, which is the tube that carries semen, and they take out part of the vas deferens through the incision. They then cut it and seal the vas deferens by tying and cauterizing it, and then returning the vas deferens to the scrotum. And then the doctor will close the surgery site with stitches or glue. So here's a picture showing the before and after of a vasectomy with the vas deferens divided. So what are the contraindications for vasectomy? The anatomy of the male, such as the ability to palpate and mobilize both vas deferens, or having large hydroceles or varicoceles. If the male has a past trauma or scarring of the scrotum, and if he has a local scrotal infection. So the side effects for vasectomy, for chronic side effects, there's pain, epididymitis, which is the inflammation at the back of the testicle that stores sperm. There's vasovenous fistula, so multiple blood vessels adhere to the vas deferens, and then injured when having the vasectomy. A sperm granuloma, so a lump of sperm that causes cysts or bumps. And acute side effects include discoloration of scrotum, bleeding or hematoma, surgical site infection, or swelling. The advantages, it is a permanent way to prevent pregnancy for men who do not want children. There are no lasting side effects on sexual performance. It is easier to perform than a tubal ligation. It's cheaper than a tubal ligation, and you go home the same day. The disadvantages include, although that it may prevent pregnancy, it does not protect against sexually transmitted diseases. The reversal of vasectomy is actually more complicated than the vasectomy procedure itself, and reversal is not always possible. The effectiveness, it is one of the most effective forms of birth control, but it takes about 3 months after surgery for the semen to be completely sperm-free. A semen analysis test can be done to check sperm amount in the semen once the doctor gets a sample, and there's always a very rare chance that the cut ends of the vas deferens grow back together, but it is extremely rare. So then we're going to look at bilateral tubal ligation. So this is a permanent form of birth control for women, and it often known as females getting their tubes tied. So it involves cutting, blocking, or tying the fallopian tubes to prevent pregnancy. And what this does is it prevents an egg from traveling through the ovaries, through the tubes, and from the sperm traveling through the tubes as well. So the procedure involves an incision being made through the belly button. The abdomen is inflated with gas, and a laparoscope is inserted into the abdomen. The doctor then uses instruments to seal the fallopian tubes with rings or clips. So over on this side, you can see the picture. This shows the clip sealing the fallopian tube, and you can see that they clip both fallopian tubes. Contraindications for this include active infections such as PID, pelvic inflammatory disease. The laparoscopic approach is contraindicated in women with severe lung or heart problems, and also being pregnant is a contraindication. Side effects include the surgery can cause damage to the bowel, bladder, or major blood vessels. They can have a reaction to the anesthesia. There can be improper wound healing or infection. or continued pelvic or abdomen pain. The advantages, it does have a great success rate of preventing pregnancy, and it actually can reduce a woman's risk for developing PID and also ovarian cancer, because when the tubes are tied, the blood supply to the ovaries is interrupted, and this can alter hormone levels and in turn reduce the risk of ovarian cancer. And just like vasectomy, you go home on the same day. Disadvantages, tubal ligation does not provide for protection against sexually transmitted diseases, just like vasectomy. It is more complicated than a vasectomy to perform. General or spinal anesthesia is used, while vasectomy only uses local. It's more expensive than a vasectomy, and in the rare case that the tubes do not completely close and the woman does get pregnant, she's at an increased risk for an ectopic pregnancy. Effectiveness, BTL is more than 99% effective. About 1 out of every 200 women will still become pregnant after tubal ligation. Although it's more effective than other forms of birth control, it is important to know that it doesn't guarantee complete chances of not getting pregnant. And that small failure rate occurs because the fallopian tubes may reconnect by themselves, but it's very rare. And then when considering finances for both BTL and vasectomy, we talked about how BTL is more expensive than vasectomy, but you could actually save hundreds of dollars over time when getting this procedure, when compared to continuously buying other contraceptive methods. And women should check with their health insurance policy, as coverage for birth control varies. And Medicaid and private health insurance can also cover the costs of BTL. And then a vasectomy costs between $800 and $1,000, and most health insurance companies will cover vasectomy costs if performed as an outpatient procedure, but men should also still check with their insurance provider. And again, Medicaid or other state programs may also cover the cost of a vasectomy. That's it.